Hello, how are you? Today I'm going to tell you about the worst mistake that people with high blood pressure make. Many people with high blood pressure make these two mistakes. One of them is the worst of all, which can harm your diagnosis, your treatment, and even put your life at risk. So stay until the end because you won't want to miss it. Before we start, I want to ask you, how old are you and what is your usual blood pressure reading? Do you have that little device to measure your blood pressure at home? Do you usually check it? Do you measure it more often at the doctor's office? Or do you measure it at the pharmacy? How does this work for you in your daily life? Write it for me in the comments. I'd love to see your response. And if you like this kind of video and you like and trust my content, leave a like on the video. This is really important for me here on YouTube. So let's start talking about this mistake, which is super important and it really is a big warning. I know that many people who live with hypertension have that little device to check their blood pressure at home, but unfortunately, they often take their blood pressure readings incorrectly. Whether it's because they don't take the necessary precautions before measuring, because yes, there are some things you need to do before taking your blood pressure, and I'll tell you what they are, or even when using the blood pressure device itself. A very common mistake is measuring your blood pressure at any time. People think they're feeling a bit unwell, or that they ate something that might affect their blood pressure, and they measure it at any random moment during the day. I've seen people measuring their blood pressure while walking, with their legs crossed, or right after exercising. They just go and measure their blood pressure. They just had a coffee and then go measure their blood pressure, and then they believe that number and get stressed out about the result they see there. So it's very important for you to know how to measure your blood pressure correctly so you can trust that value. Because think about it, if you're using the device incorrectly, that value won't be a reliable reflection of your actual blood pressure. So there's no point in trusting it, let alone bringing it to your doctor as a standard. I'm going to explain to you now what precautions you should take before using the blood pressure device and how to use it correctly to get the most accurate reading possible. I'm going to tell you about the second mistake, which is also extremely dangerous and often happens because of this incorrect measurement. So let's get to it. You have your blood pressure device. So how do you measure it the right way? This is very important. Ideally, you should have a device, preferably one for the arm. The ones you use to measure at the wrist aren't very accurate. So ideally, you should have the one where you wrap the cuff around your own arm and the cuff should be the correct size for your arm. I've also seen people using a child's cuff. Don't do that. It needs to fit snugly in a comfortable position on your arm, not too tight, but also not loose. That's why it comes with that Velcro, so you can adjust it on your own arm. 30 minutes before taking your blood pressure, you shouldn't have coffee, you shouldn't smoke, and you shouldn't do physical exercise, okay? And your bladder should be empty. When you need to pee, it can also affect your blood pressure, and many people don't know that. Another important thing is the position you're in when you measure your blood pressure. Some people, when they're going to measure their blood pressure, sit on the couch with their legs up, go to bed, lean back, lift their legs. This can affect your blood pressure. So ideally, you should sit with your back supported, on a chair, with your feet flat on the floor, without crossing your legs, and your arms supported at heart level. So where is the ideal place? At the dining table, at your work desk, at any table where you can rest your arm, right? The arm where you put the cuff, this one or that one, always use the same arm, right? If you measure on the left, always use the left. If you measure on the right, always use the right. Pick one arm for yourself and use it as your standard arm. Rest it there, wrap the cuff around, and keep it supported. Ideally, the cuff should always be placed directly on your skin and about 2 fingers above the bend of your elbow. During the measurement, you shouldn't talk, no chatting, no small comments, as if nothing were happening. Just stay quiet, maintaining a calm stillness in complete silence. And breathe normally without taking deep breaths or breathing too fast. Just breathe as you normally would. I know some people get anxious, some people get stressed. If you feel like the first measurement was taken while you were too stressed, just measure again. There's no problem with that. In fact, the ideal is to take 2 measurements with an interval of 1 to 2 minutes and preferably consider the second measurement, or take the average of the 2. Because as I mentioned, sometimes during the first measurement, the person is very stressed from having put on the equipment makes them worried. And there are people who have white coat syndrome. Just the act of measuring can already cause stress and make your blood pressure go up. So usually doctors recommend that you give more consideration to the second measurement. The at-home protocol is to measure your blood pressure in the morning, before breakfast, right after waking up, and before taking any medication. So you wake up, go to the bathroom, wait 30 minutes without doing anything, and then take your first blood pressure reading of the day. And you can also do it at night, taking the same precautions I mentioned 30 minutes beforehand for 5 to 7 days. Write it down and take this information to your doctor. Doctors ask you to do this for 5 to 7 days when they want to get a sense of how your blood pressure is at home. Because there are people who go to the doctor and have this white coat syndrome I mentioned, and when they get there, their blood pressure goes up. At home, you're usually in a controlled, calmer environment, so this often doesn't happen. Now, if you're repeatedly experiencing this stress with the device, maybe the doctor will ask you to use that blood pressure monitor, the one that stays on your body all day, to check how your blood pressure is over 24 hours. The second mistake is related to this improper measurement. Some people measure their blood pressure incorrectly and sometimes not, right? Sometimes you measured it correctly, you were doing everything right, but it has to do with you changing your medication on your own. Because sometimes the person thinks, look, my blood pressure is great, I'm measuring it here, and it's 110/70 every day. I think I don't need this medication anymore. They lower the dose, stop taking the medication on their own. Never do that, it's very dangerous for you. Or they think, oh, today I don't need it, I'm feeling calm, I'm zen. Or on the contrary, oh, I'm really stressed today, my blood pressure is high, nothing is controlling it, I'm going to increase it, I'm going to double the dose. Don't do that. If your blood pressure has been consistently high, talk to your doctor, attend your appointment. He will adjust your medication. You should never stop taking, increase, or decrease your blood pressure medication on your own. That is very, very dangerous for you. And you also can't take your medication one day and skip it the next. Blood pressure medication is not a joke. It affects your heart and your blood vessels. So always follow your doctor's prescription, and if you have any questions, talk to him. He's the one who saw you in person, who knows you personally, who knows your medical history. Don't change anything on your own. This is very important. Let me know down in the comments if you were already doing everything right, or if you're going to change anything about how you measure your blood pressure. I'd love to see your comment. Remember to like the video, that really helps me out, and share it with anyone who needs this information. Let's work together to grow this chain of good, because that's what I want here with the channel. See you next time. Bye.